Hi everyone, Dr. Patel here with Hillside Medical Group. This is our AI training. So I'm going to be doing this AI training with you guys to show you how to register, how to get yourself onboarded, and do a training on how it works. So hopefully this helps. By now, you should have already received an email to make an account for Sully AI. So hopefully you've done that already along with your username and password. And username is the email where you received a link to get your AI onboarding or registration done, and then password you should have created your own password. So with that said, let's get started. So I am in the regular schedule. We're going to be working in the playground with test patients, so we're respecting HIPAA over here. And normally, in order to get this, you should already have a device issued to you, potentially a laptop. And what you would do is you would download Chrome to your device. And once you get to Chrome, you would go to Google and you would type in Sully.ai Chrome, extension. Once you do that, you should have with this Chrome Web Store Sully.ai Chrome extension. And then you should have a button over here that says download Chrome extension. Mine is already downloaded. That's why it says remove, which I can. So theoretically, it should look like add to Chrome for you. Add extension. Perfect. And once you do that, a little Chrome extension for Sully would look like over here. Click on this button and then turn that, pin it to your bar. So it would always look like this over here. So that's the first step of going to google.com, typing in Sully.ai Chrome extension. It'll bring you over here. Download this Chrome extension and then click on this little button over here and pin it so that way it'll show up over here all the time. Wonderful. Once you do that, go back to Practice Fusion, log into your account, and then the next step you will do once you're in Practice Fusion is you'll click this little button over here and a little screen on the pop-up should show up like this. Wonderful. Once it does, now remember that user ID that you created. Mine is Kiran Patel at hillsidemedicalgroup.com. And then I'll put in the password that I had created. I'll log in. So once I log in, it'll say hello Patel or your name, hello, how can I help you today? Wonderful. So that's the first start to it. Next step we're going to do is we're going to click on these little 3 bars over here. We're going to go to App Agent. And then I'm going to pull this out. I'm going to pull this out. And then once I'm in App Agent over here, I'm going to look for our EMR, Practice Fusion. I'm going to connect. Once you're there, you're going to make sure that the ID it says is Hillside. Connect to Practice Fusion. I'm going to go back, connect, and log in over here. And it should come up to this screen. Now, super important, you only mark off subjective, objective, assessment, and plan. Only 4 of those things. Nothing else to it, just those 4 things. And then done. Once you do that, it'll come back to this main screen. Hold this all the way to the right. And that's perfect. Wonderful. Completed. At this point, I'm going to go back to my original because I want to make sure the HIPAA is not violated by this. So I'll remove this one. I'll go back to my original, and these are my patients. So normally, once you log in, it will always stay in the side over here. If you want to get rid of it, you just click on this button, it'll get rid of it. You want to bring it back on, you bring that, and it should keep you logged in all the time. Wonderful. For most part, you will only deal with 2 tabs, which is visit and patient. That's it. Nothing more. Most of the time you should be only here, but I'll go back to the main screen and this is where you are. So theoretically, let's say a patient's come to you, your staff has made it arrived, followed by in room 7, done, the patient's in room 7, you want to go see this patient. What happens? You're going to the patient's room with your laptop. And theoretically, let's say this is a new patient. I'm going to just hit view encounter. And once I do view encounter, it will automatically populate the visit over here. I'm sorry, I'm gonna need to just refresh this because when I connected it, it didn't pick up, said it had connected, but once it's connected, then it'll show record with Sully and pull AI over here. Going back to it, when I go over to my schedule and when I say playground, back to my appointment schedule, and when I say view encounter, it will automatically plug that patient, pull the patient over here. Okay. I'm gonna cross this off and right here, the patient had come up. One more time, let me just pull that so that way you're familiar with it. I'm gonna be theoretically, let's say, on a home screen, and when I go to schedule, if I'm in home screen and when I'm in schedule, when I do view encounter, it will automatically bring that patient and tag that patient. Okay, I'm gonna cross this off and then click anywhere over here to verify that the patient that you're about to chart on matches. B test, B test, B test, test. Yep, it matches. Now, let's say I'm in the patient exam room. Normally, what I do is just start recording before I walk in, and then just start having conversation with the patient. Hi, Mr. Test, I see that you're a 64-year-old male. I'm looking through your chart from my last visit. I see that you have history of chest pain. You came to us a few days ago with a complaint of chest pain associated with some nausea and vomiting. How are you doing today? Oh, my chest pain is still continuing. It's very sore and I'm still becoming very nauseated. Okay, can you show me exactly where it hurts? Right here by the belly button. Okay. Are you still having nausea and vomiting? No, the nausea and vomiting actually have gotten better, but it seems like I'm having diarrhea now. Okay. Are you also having belly cramps? Oh yeah, I'm starting to have belly cramps as well. Okay, seems like we gave you some heartburn medication last time. Did it help? Yeah, it started making the chest pain better, but the diarrhea started now. Okay, anyone else sick at home? No, no one's sick at home. Okay, any blood in vomit or blood in stool? No, I don't have any blood in vomit or blood in stool. All right. I also noticed that you have a history of a high blood pressure, diabetes, and cholesterol. Are you tolerating your medications okay? Yeah, I'm doing okay with my medication. I've been on it for a long time. Okay, wonderful. I see that you have a penicillin allergy. Past medical history only includes a high blood pressure, diabetes, cholesterol, and then of course this ongoing chest pain. For the surgical history, I see that you've already had a appendectomy done. And for family history, I noticed that you do have a family history of colon cancer. Does that all sound right? Yeah, that sounds right. And you don't smoke, you don't drink alcohol, no drug use. No, I don't do any of that. Okay, as far as my exam, let's get you on a table and do a quick exam if that's okay with you. Sure. All right. So now that I have you situated over here, seems like a normal exam, except for when I'm pressing on your belly, it does look like you're a little sore to tender to palpation. It doesn't look distended, and I can hear a good bowel sound, so that all looks great. I do also notice there is one plus swelling in your legs. Okay, okay, so as far as assessment plan for your blood pressure, diabetes, and cholesterol, we're going to continue to the present care. I'm going to send in refill on some of your medications. Today, meanwhile, we're going to get some labs done 1 week prior to your next appointment. Meanwhile, more importantly, this abdominal pain that you've been having seems like maybe a viral gastroenteritis, maybe a virus just passing through. I will continue with the PPI challenge, the omeprazole that I gave you last time. Continue to take it 1 tablet twice a day for another 4 weeks. We're going to check some labs to make sure it's nothing significant, nothing else, potentially colitis, inflammation of your colon, or um, ulcer. So we're going to get some labs done over here today, rule out gallbladder disease and everything else. I'm going to give you order for ultrasound as well. And why don't we do this? Let's follow up with you in 2 weeks to go through your lab results and ultrasound. Does that all sound okay to you? Yeah, I think so. That all sounds good. I'll see you back in 2 weeks. Wonderful. Okay, so with that said, I'm going to just to finish with it. So I saw this patient, the patient's comorbidities were mentioned, so AI picked up on it. We're going to mention just as we're reviewing from the last note, so that way a lot of those diagnoses and family history and social history will get caught on. All right, now let's take a look at what the note looked like. So view. Okay, so my recording for him is right here. And then let's see what it looked like. So looking through it over here, it picked up our chief complaint: chest pain, nausea, vomiting, diarrhea, belly cramps. Okay. 64-year-old male with ongoing chest pain, describes very sore, presented a few days ago, nausea and vomiting. Nausea and vomiting have improved, now experiencing diarrhea and belly cramps. The chest pain is located near belly button, reports of heartburn, prescribed medications during last visit, helped alleviate chest pain, but diarrhea since developed. No blood in stool. So picked up a pretty good HPI. It picked up great past medical, picked up our allergies, picked up the social history, family history of colon cancer, along with our social history. So overall, did a great job on scribing that out for us. Objective, this is a standard normal exam that you would be using for the organization which it picked up on, but also it corrected it out with abnormal. So it said, 1+ swelling in the legs, a tender to palpation abdominal area, especially near belly button, no distension, good bowel sound. It just as I mentioned. Labs, it said, order labs to rule out gallbladder disease, ultrasound also ordered. As we said, assessment and plan gave us all the list of our diagnosis, but along with that, made a plan. So let's look at the plan. So abdominal pain and diarrhea, continue PPI, omeprazole, labs ordered to rule out all of these, schedule ultrasound to evaluate this, follow up in 2 weeks. Did a pretty good job of that. Hypertension, type 2 diabetes, hyperlipidemia, said brief medication schedule. Allergic rhinitis, consider allergy testing. Now, I think it picked that up due to our allergy to penicillin, but overall, you can correct this out when you copy paste it and remove it if you don't think. And then in general, always will give this last statement: hey, patient is advised to go to urgent care or ER if worsening symptoms such as abdominal pain, etc. So overall, I think it did a fabulous job, picked up our follow-up, picked up all the details of the plan. Now, say you're not satisfied with this and you want to get more details in the plan, you just say regenerate, add more details to the plan, and then it will just add more details to the plan. Well, won't really touch anywhere else. It's still creating it, so I'm going to let it create. How do I know? Because it's doing this funny buttons over here. But I can also go down. There we go. So abdominal pain, hypertension, just added a little more lifestyle monitoring, modifications, etc. Added more to the plan. So what are we going to do with this? How are we going to bring it to our note? So there's 2 ways of it. What we're strongly advising is just click anywhere over here. Do Control All, which is Control A, Control C. Never use the button of copy all over here, but it misses some general advice in that. So again, go to Control on your keyboard, A for all, then Control C. So now you copied it, and then I would just bring it down to the note, paste. And the whole note is here. You're really essentially done with the note. You have your subjective, you have your objective, you have your assessment, and you have your plan. Now, as this will change because we're changing the template out, that rather than it doing SOAP, it will just have one block and your SOAP is already mentioned here. Now, said that, while you're talking to the patient, you can multitask, right? As it's recording everything, you can just go to actions and you could have just added lab order for this patient. I'm going to drop down to Hillside and you could have just added the labs to their plan, right? So just for a quick to it, I'm just going to do this for now. And I could have done this at the same time. I could have ordered an imaging order at the same time by just getting ultrasound and send it to the printer, right? So there's a lot of multitasking where let it record on the back, you do your orders and medication refills, etc. So by the time you end the recording, it's actually completed and you can move on to the next patient. So going back to this, the note will come out here, save. If you're already signing your notes, sign, and you're done with it, move on to the next patient. So this is pretty much the AI. A few things to look at while you're doing it is make sure when you're recording it shows the template HMG, which is Hillside Medical Group template that's being used right here, HMG org. So when you come down, it should drop down. They're different. You want to try to be at HMG org. That's the one that has that exam built in and sort of a level of the checks and balances that we put in. So I hope this helps. Review it a few times. If you run into issue, then please let me know. Of course, we will also do a personal training in the next time, but this is something I wanted to share with you so you can at least review it. Thank you.